Next speaker then, that would be Ms. Hend Abdullah Al Jaffar from the Kingdom of Saudi Arabia.
Okay.
Thank you.
Hello, everyone. My name is Hend. I'm a certified senior health educator. It's my pleasure today to share my 14 years experience in health promotion and health educations. I'm a health promoter director in Eastern Province region, E1 cluster in Saudi Arabia. I'm holding a community health degree and a master degree in health communication from Sydney University. The learning objective of my today talk, I will go through a comprehensive overview of health promotion strategies and action. Then I will describe how we use this strategy and digital technology. Then I will illustrate the most common digital technology have been used recently for health promotion and health communication purposes. Then I will give you some snapshots about the limitation of using digital technology and some ethical consideration. Health promotion is a very important component in public health. WHO defined health promotion is a process of enabling an empowerment individual to take control over their health. It's go beyond actually individual behavior. It's focused on a wide range of social and environmental factors. So health promotions, it's focused on improving or maintaining health. The question is, what is health? World Health Organization define health as a state of mental, physical, social well-being. It's not just about absence of disease. That's mean health not determined by single factor. There's a variety of factors it's help or contribute to determine health. In fact, all these factors like environmental or genetics or social factor not only just impact health, but can make it easier or difficult even to change health. Over the time, health promotion, the importance of health promotion received a global attention. In 1986, World Health Organization organized the first health promotion conference in Ottawa, in Canada. And the upcoming document of this conference was Ottawa Charter. The Ottawa Charter has 5 action areas and 3 strategies. Let's have a closer, and this strategy is considered as a guideline or the landmark of health promotion practice. I would like to have a closer look to the Ottawa Charter action strategies. The first action, which is building public health policy, and that's something like smoking regulation in a public area or the tax over sugar drink and traffic or seat belt tax. That's considered all the public health policy to regulate and control health promotions. The second action area, creating supporting environment. That's much related to the education or the house or the place where we are working or the place where we are playing. How this place sitting help or enhance or make the health choice much easier. And that will be clearly as an example, the walking program in a community and how we can link individual to the community. The third action area is strengthening community action, like how we can empower community to take action regarding certain health issue, like the organization that's supporting HIV patients or other minority group in the community. The fourth action area is reorienting health services, which is related to the healthcare setting and how this healthcare setting providing the necessary services to enhance individual skills and control the other risk factor such as diabetes. The last action area, developing personal skills, and how we can enable individual to develop his skills by providing the necessary information and life skills to improve or maintain his health. Let's move on to the strategies. The three main strategies for health promotions is advocate, mediate, and enable. Advocate, that means how health promotion practitioner should establish social system that support or maintain health. Mediate, as I mentioned, health promotion between different organization and community. So a practitioner can mediate between private or governmental organization to control all the health risk factors. Enable is more related to individual, how we can support individual with necessary information and skills, and consider individual as a partnership to take the related decision to maintain or to take care of his health. Digitize health information, what does it mean? And this is an upcoming slide. I'm going to review how we apply the strategies and the concept of health promotion in digital way. First of all, I would like to explain why we consider using technology become a vital nowadays. We become technology dependent in 21st century. So targeting the online community to promote health is considered a fundamental approach in health promotions. There is more than 4 billion users of the internet. So we have to reconsider our new approach of prevention through targeting the online community. The technology nowadays actually has a potential and a strength and providing great accessibility to information for the populations and help the health promotion practitioner to reach the hard to reach groups such as the HIV patients or patient with disability. It's also considered limited funding if you compare it with other public intervention. Now I'm going to illustrate the most common innovation technology has been used commonly for health promotion purpose. And the first, the smartphone and health apps. Smartphone and health apps actually declared by WHO is one of the best practice to communicate health. There is more than 50,000 health apps available for everyone in Android or Apple's store. What I like about these apps is some of these are free and it's considered low cost if we compare it with other innovations. It's also low cost to download this app rather than going to the physician or a real health coach. Mainly this app used to monitor exercise and diet and weight and counting calories. I'm highly recommend for health educator to use the health apps for their health education programs. It's easier to set a goal and track your patients, and even to give your patient a feedback rather than and avoiding some emotional interaction from your patient by rather than face-to-face. Rather than face-to-face discuss with patient his negative feedback. The second platform, health websites. What I like about health websites, it's to provide an anatomy, particularly for if we are looking for a sensitive topic such as mental health issues or sexual health issues. It's to provide population accurate and comprehensive source of information. It's commonly used by health organizations for booking appointment nowadays and tracking the patient treatment plan and result. I highly recommend for health promotion practitioner, a health educator, to establish a website for their any health promotion program or campaign as an accurate source of information. The other innovation is personal wearables devices. It's commonly used recently by young people in particular. Nielsen, in his pilot study for women physical activity, he found that women who's wearing this device, they feel more empowerment and controlling their lifestyle, such as their diet, counting their calorie steps. In fact, it's helped them to also to improve their performance and maintain their physical activities. It's considered also a fashionable accessories nowadays for most of fit and young people. The other innovation used for health communication for years, the Helplines, it's considered successful health communication channel, particularly for child abuse services and domestic violence services. It can be used also for a healthcare setting. It's decreased the load from GB to the nurse and also reduce the cost of using the health services. And it can use also for telephone coaching, like managing and empowering and motivate patient to be more adherence. And it's commonly used everywhere for smoking cessation session. Social media and social networking, it's very common used by health organizations everywhere. But unfortunately, they are using social media mainly in one way of communication rather than engagement or participation from audience. That's maybe due to lack of skills or knowledge how to run this social media services for health promotion purposes. Social media is considered affordable and easy choice for everyone. It's for free. What I like really about social media, it's help to provide the social support and also improve the relationship between organization and population as well. This is example how World Health Organization used a Twitter platform to disseminate prevention message in Ebola in 2014. And there was a clear correlation between the number of tweets and the cases of Ebola and how it was very effective. I highly recommend to use a Twitter platform, particularly during a crisis. It's considered the fast and easiest way to disseminate a prevention and warning message to population. We have also to consider using social media platforms. It's verified according to gender and races and education as well. For example, most of women, they are preferring using Instagram as a platform for communication. So for health promotion practitioners, we need to consider our target population before we choose or select the proper platform. To sum up, before establishing any social media platform for health promotion purposes, we need to, first of all, we need to select the proper platform. We need to keep up to date to the development of this innovation. Also, the most importantly, to get the potential benefit from this platform, we need to encourage participation and engagement with user. It needs to be also theory-based innovations, monitoring of effectiveness and tracking of the program. It's highly recommended as well. I would like to have like a second and think as a health promotion or health educator practitioner, if you would like to establish social media platform for health education or health promotion purpose, what social media platform would you choose and why? And what kind of support and resources you would need to get the potential effect from this platforms? Anyone? So I will leave you for like a while. So I would like everyone to think a little bit what's in his country, what platform would be proper for his target audience and for his background or her background. Unfortunately, like all other innovation, there is some risk related to use of social media. Mainly is the misleading information. When user reply or the information, sometimes they added some meaning to the original information, and that's what might lead to have misleading about the meaning of the information. This is considered one of the risks. The second risk is the sustainability of information, and that's clearly happened during Corona crisis. At the beginning of the crisis, when WHO declared that wearing face mask is not necessary for prevention from Corona infection, and this information actually it was disseminated everywhere in all the social media platforms. Later on, when WHO changed the recommendation about the importance of wearing the face mask for corona prevention, that makes people feel a little bit confused because in the same platform there's two contradicted information about the precaution, and this is considered one of the risks. The other harm, it might related to the user because social media is not secure 100%. There is no privacy, and cyberbullying, it's highly happened between in the platform there is a group of discussion or participation or required the group participation. So we need to have a look and we be careful about all this risk, about all this limitation and risk related. Generally speaking, most of older people, they don't really prefer the social networking for communication. According to many studies, only 21% of older people, they like or they use social media. So we need also to consider face-to-face in our health promotion, particularly for people with lower reading skills, such as, elderly people. We need also to consider the low touch technology or the old technology such as radio and television in our health communication. And this really highly effective channel of communication, particularly for people with lower reading skills or the driver or people who's move all the time. Many of a drunk driver campaign, they target the driver. They use the radio as a main platform for communications. The television options provide a great option as an entertainment learning to communicate or for disease prevention communication. The mobile phone text message considered a very cost-effective intervention in any health organizations. It's very effective to use as a reminder for medication adherence, for example, or for smoking cessation, for example. But very importantly, to personalize the text messages when you communicate your patient. Like, for example, dear Jan, we would like to remind you to take your medication. Many studies shows that when you personalize the text message become more effective than sending general text message to your patient. When I talk about health promotion, I have to talk about how we can change the behavior using this technology. In particular, how we can apply the behavior change approach to this technology. In fact, using the using of technology of behavior change theory is still unclear, and it is an area for research. In fact, more of digital innovation and intervention, not based on theory. Maybe that's related because maybe of most of health change behavior theory module, it just focus on individual attitude and behavior and goal, and they are paying a little attention to other factors such as social and economic or even political dimension if using this behavior. If I would like to just have an example, if using social cognitive and control theories and health apps, they are using advocate the feedback. So when you send the feedback to the user, that's help him to improve his performance, or maybe he track his performance and reconsider to adopt a healthy lifestyle. Social marketing approach, it's also used in health campaigns. They are using the persuasions and all the marketing strategy to change population behavior. And it can be seen clearly in any health and digital campaign. If you would like to design effective health intervention, we need, first of all, understand our population, what our population thinks and believe, what their attitude. It's nearly impossible to design effective message and bridge the gap between experts and population if you don't understand what your population think about certain risk. The ethic of using health promotion strategies and digital, it's normative, it's related to equity, equality, and social justice. And it's related more to health promotion practice, like, as I mentioned earlier, how we can protect our user, the privacy, and protect them from bullying and digital world. So in conclusion, there is a general agreement that using digital tech development has a potential for health promotion and healthcare in general, but we have to recognize the threats and weakness of using this technology. This technology, it might be empowerment and disempowerment if not used properly. My key message for my talk today to all health communicator and health promotion practitioner, please stop blaming individual for his health. We need to reconsider all other factors, social, economic, political factor, to help individual to maintain or to improve his health. I think I over my presentation. Thank you for your attention, and I'm so glad to receive the question right now. I can't hear you. I can't hear you.
I was saying thank you so much, Ms. Hend Al Jaffar.